Hi, I'm Dr. Ference. I've been in practice for 18 years. I started the Joint Plus Excel program for the Detroit Medical Center in 2004. I have done over 6,000 knee replacements. We've seen everything from the simple knee replacements to the most complex deformities and flexion and extension contractures. And so we treat the gamut. We also see patients that are very thin to the very obese in the 300-pound range, and we treat them as well. Typically, the obese patient progresses much slower because their strength is usually lower, their range of motion is usually lower because the leg is so big so they don't have a natural range of motion. But with the X10, we're getting outstanding results, and it's just incredible. We've done many morbidly obese patients on the X10. One of the things is if they can't walk, they can't lose weight. So they're stuck in a vicious circle. They're sedentary and they can't break that cycle. And so we've used the X10 prehab and post-operatively, and they've done just as well as the people with normal BMI, and it's been just amazing. As a matter of fact, we've used it on revisions surgeries, complete revision surgeries, and they've done just as well as primary knees, which is astounding. First time I found out about the X10, I had a patient who had a quadricep rupture and had a severe arthritic knee. Now his preoperative range of motion was just 90 degrees of flexion. And the adage is, what you start with is what you get. And we obtained 130 degrees of flexion on a patient, which is unheard of after a quadricep tear because they scar, but we were able to obtain 130 degrees of flexion. My protocol before using X10 was I would send them to therapy. Typically, they would be in 12 weeks of therapy. Some people were making gains, but some people weren't making gains. Now, when they go to therapy, what happens a lot of times, they get real aggressive and they'll push the patient to the point of severe pain, and it will cause inflammation and swelling. And then they get set back and the patient gets disheartened and they feel like they're falling behind. Now, on the patients that we used in our first trial, X10 alone, I was so pleased with their early range of motion. I was astonished with their strength increases. They were coming off their assistive devices so early. They used a lot less narcotics and had much better pain relief. They were getting 0 to 130 degrees by 4 weeks. We were increasing quadricep over 150%. It's never been shown in the literature that you can increase quadricep strength. And we're showing at least 150% increase, if not more, in our patients on the X10 machine in quadricep strength, which is remarkable. Then we started a trial 2 study where we incorporated the X10 with in-home therapy followed by outpatient therapy. Now, I found those patients progressed a little slower than just the X10 alone. Well, the thing with the X10 is they provide a coach. Patients feel very well cared for. They feel like we're taking great care of them and taking great interest in their progress, which is wonderful. Everybody wants to feel like that they're being taken care of. The coach has been incredible. They keep in constant contact with me so we can follow the patients and we can make adjustments accordingly if we need to increase the strength here or increase the strength there or increase the range of motion. We can jump, we get it early because the coach informs me early. It's just been a wonderful experience, and the patients love the coach. They feel like someone is watching over them and taking great care. Getting weekly data has been incredible because I get to see how they're progressing each week, and that will allow me to determine when we can release them from the X10 program. Now with therapy, I never get the therapy notes, so I don't know what they're doing until they show up in the office. I constantly tell the therapists to send their progress notes, which rarely occur. and it's very disappointing. So you would walk in and you would hope they were doing great, but you never knew. Now with the X10 and getting the weekly data, I know how they're progressing, so I know what to expect when I walk in the room, and my anxiety level goes down. It's just been very beneficial for me as well. Patients rave about the X10, and as a matter of fact, every patient that gets the X10 who refers me another patient, they all want the X10. They do so much better on the X10 than with therapy.